In the summer of 2016, a 24-year-old woman named Amara walked into her 11th doctor's appointment in 7 years. 11 doctors, 7 years, and not a single one of them had given her an answer. She had spent those years being handed diagnoses that didn't fit, prescriptions that didn't help, and explanations that felt like closed doors. She had filled notebooks with symptoms. She had cried in waiting rooms. She had driven hours to see specialists who spent 8 minutes with her before moving on to the next patient. 3 weeks after that 11th appointment, Amara collapsed in her kitchen and didn't wake up for 4 days. And when she finally opened her eyes in that ICU bed, surrounded by machines, tubes, and a family that had been told to prepare for the worst, everything changed. Because somebody had finally looked closely enough to see what everyone else had missed. To understand Amara's story, you have to understand who she was before it began. She grew up in Lagos, the second of 4 children, in a household that valued education above almost everything else. Her father was an engineer. Her mother taught secondary school mathematics. Amara absorbed their discipline completely. She was the kind of student who finished assignments early just to review them again. She ran track in secondary school, played the keyboard, and had already decided by age 15 that she wanted to go into research, biochemistry specifically. She wanted to understand how the body worked at the molecular level. The irony of that ambition would not become clear until much later. By every measure available, Amara was healthy, strong. She had never been hospitalized, never had surgery. Her childhood medical records were almost embarrassingly clean. And then she turned 17, and something shifted. The first sign was so small that Amara almost didn't notice it. A tremor. Just in her right hand, just occasionally, when she was tired, when she had drunk too much coffee, when she had been writing for a long time. The kind of thing you could explain away 100 different ways. But Amara was a careful observer. She noticed that the tremor appeared even when she wasn't tired. Even on mornings when she had slept well and hadn't touched caffeine. She mentioned it to her mother, who told her she was probably just stressed about her university entrance exams. Her mother wasn't wrong to think that. It was a reasonable explanation. It was just the wrong one. Around the same time, her mood began to change. Not dramatically at first, just a short temper where there hadn't been one before. Frustration that rose faster than it should. Occasional waves of sadness with no clear cause. Her friends noticed she seemed different. She noticed too. But she was 17 with exams to pass and a future to build. She pushed it aside and kept moving. Her first doctor was a general practitioner she had been seeing since childhood. He examined her hands, observed the tremor, and within 10 minutes had arrived at a diagnosis: essential tremor. A benign, common condition. He prescribed a low-dose beta blocker, told her to reduce her caffeine intake, and sent her home. The tremors didn't stop. They got slightly worse. Her second doctor referred her to a psychiatrist, having decided the mood changes were the more pressing issue. The psychiatrist, who spent 20 minutes with her, concluded she was experiencing moderate depression, likely triggered by academic pressure. He prescribed an SSRI antidepressant and asked her to return in 6 weeks. She returned in 6 weeks feeling foggier, heavier, and no better. He increased the dose. She spent 2 full years on antidepressants that were treating a condition she didn't have, while the condition she actually had continued its quiet, invisible work inside her body. By the time she was 20, she had also started seeing a neurologist who ordered an MRI of her brain. The MRI came back normal. He told her this was reassuring. She didn't feel reassured. A normal MRI meant there was no explanation, and no explanation meant, in the medical shorthand, she was beginning to learn that the problem was probably her. Doctor after doctor, each one looking at one piece of the puzzle. None of them stepping back to see the whole picture. When Amara was 21, she noticed something new, or rather, she noticed that something had changed about her eyes. Not her vision. Her eyes looked different. Around the outer edge of her irises, there was a ring. Golden brown, subtle, but unmistakably there when she looked closely in the mirror under bright light. She photographed it on her phone and brought the photo to her next doctor's appointment. The doctor leaned in, looked, and leaned back. He told her it was likely just pigmentation. Some people have rings of color around their irises, he said. It was cosmetic, nothing to investigate. He was wrong. That ring had a name. It is called a Kayser-Fleischer ring, named after the 2 German physicians who first described it in the early 1900s. It forms when copper deposits accumulate in a specific membrane of the eye called Descemet's membrane. It is not cosmetic. It is not a variation. It is a clinical sign, one of the most specific diagnostic signs in all of medicine, and it is present in the vast majority of patients with neurological Wilson's disease. Every doctor who had seen Amara's eyes after the age of 19 had potentially seen that ring. Not one of them had recognized it for what it was. Not one of them had known to look. By 23, Amara had added 2 more diagnoses to her file: functional neurological disorder and conversion disorder. These are real conditions, but they are also, sometimes, what doctors write when they cannot find another explanation. When the tests come back normal and the patient keeps returning with symptoms that don't fit any clean category. She had started to internalize what the medical system was telling her, that maybe she was someone who amplified symptoms, that maybe her body expressed stress in unusual ways, that maybe the problem was psychological in ways she hadn't fully accepted. She was exhausted, not just from the symptoms, but from fighting to be believed. On a Tuesday morning in March 2023, Amara was in her kitchen making tea. Her flatmate was asleep in the next room. It was an ordinary morning. She reached for the kettle, and then she was on the floor. She didn't feel herself fall. There was no warning, no dizziness, no moment of knowing what was coming. One moment she was standing. The next, she was looking at the ceiling and couldn't move her left arm. Her flatmate found her 20 minutes later. She was non-responsive. Her breathing was shallow. An ambulance was called. By the time it arrived, Amara's body was in crisis. Her liver enzymes were at catastrophic levels. Her kidneys were beginning to fail. She was 24 years old, and the disease that had been living silently inside her for 7 years had finally run out of places to hide. The emergency room that received Amara that night was busy. It was a Tuesday, which meant it was understaffed. The registrar who triaged her flagged her as acute liver failure of unknown cause and called for a hepatology consult. The hepatologist who answered that call was Dr. Emeka Nwasu. He was 31 years old, 7 years out of medical school, 2 years back in Nigeria after completing a fellowship in London. He had chosen hepatology because, as he later described it, the liver was the most underestimated organ in the body, capable of extraordinary damage and extraordinary recovery, often simultaneously. He sat down with Amara's file, not just the admitting notes, the full file. The 7 years of records that her family had brought in a folder they had been carrying for years, hoping that one day someone would read all of it together. Dr. Nwasu read it all. It took him 40 minutes, and the longer he read, the more a particular pattern began to take shape in his mind. Young woman, progressive neurological symptoms, mood disturbances starting in adolescence, normal MRI, liver failure with no clear toxic or viral cause. All of it together, the combination was pointing somewhere specific. He needed to confirm one thing. Dr. Nwasu walked to Amara's bedside. She was sedated, connected to monitors, her face slack. He performed a standard neurological examination, and at the end of it, he did something simple. He took a penlight, gently lifted each of her eyelids, and looked carefully at her irises. The ring was there. Golden brown, sitting at the outer edge of both irises, Kaiser-Fleischer rings. He stepped back. He called the nurse over and asked her if she could see it. She could. He ordered a single blood test, serum ceruloplasmin, the protein that carries copper through the bloodstream. In Wilson's disease, ceruloplasmin levels are almost always critically low because the body's copper transport system has broken down completely. The result came back 4 hours later. Amara's ceruloplasmin was barely detectable. Her serum copper was dangerously elevated. Her urine copper, measured over 24 hours, was more than 10 times the normal upper limit. The diagnosis was unambiguous. Amara had Wilson's disease, a rare autosomal recessive genetic disorder caused by mutations in the AT7 billion gene, which is responsible for exporting excess copper from the liver. Without functional AT7 billion, copper accumulates. In the liver, in the brain, in the kidneys, in the eyes, slowly, silently. For years, until the organs can no longer compensate and the system collapses. Entirely treatable if caught. The key words being if caught. Treatment began within hours of the diagnosis. Amara was started on dipenicillamine, a chelating agent that binds to copper molecules and allows the body to excrete them through urine. She was also given zinc supplements, which work differently by blocking copper absorption in the gut, reducing how much enters the bloodstream in the first place. Dr. Nwasu sat with her family and explained what they were dealing with. He told them that Wilson's disease is genetic, meaning her siblings would need to be tested. He told them that treatment was lifelong but manageable. He also told them something that her mother later said she needed to hear. That nothing Amara had done had caused this. That nothing anyone had missed in her childhood could have prevented it. That the disease had simply been waiting for the right doctor to find it. The first 2 weeks of treatment were the hardest. Chelation therapy temporarily worsens neurological symptoms, as copper is pulled out of tissues and circulates briefly through the blood before being eliminated. Amara experienced more tremors, more confusion. There were days when her family thought she was getting worse, not better, but the liver numbers were improving. Slowly, then faster. By week 4, she was off the critical list. By week 8, the transplant team stood down she would not need a new liver. By month 4, her tremors had reduced by more than half. She asked a nurse for a pen and paper. She wrote her own name. It was legible. She cried. 6 months after the morning she collapsed reaching for a kettle, Amara walked out of the hospital on her own 2 feet. She was on daily medication she would take for the rest of her life. She had follow-up appointments every 3 months. She had dietary restrictions and monitoring protocols and a medical alert card in her wallet. She also had something she had not had in 7 years, an answer. A real one, not anxiety, not conversion disorder, not a body that was betraying her for no reason. A specific gene, a specific protein, a specific measurable, treatable malfunction that had been visible in her eyes for years, waiting for someone to recognize it. Amara has since connected with Wilson's disease patient communities across West Africa. She speaks about her case openly, because she knows that somewhere out there is another 17-year-old with a trembling hand and a doctor writing stress in a file. And to that person, and to anyone watching who has been told their symptoms aren't real, that their tests are normal, that they should try therapy or reduce their stress, I want to say this. Normal tests do not mean nothing is wrong. They mean the right test hasn't been ordered yet. Keep going, keep asking. The answer exists. If this story stayed with you, subscribe to Med Mystery Stories. Every week, one case, one mystery. One answer that took too long to find, but was always there, waiting.